Now imagine this. A pregnant woman struggling through labor for days without medical assistance. This is a reality throughout the developing world. And for many women, well, the result is obstetric fistula, a horrifying condition that often leaves them ashamed and childless. This month, global experts are focusing on efforts to treat and stop this preventable birth injury. VOA's Khalil Gueye reports from Addis Ababa.
Women living with obstetric fistula, survivors of prolonged childbirth that causes a hole in the birth canal and almost always a stillborn baby. The results? Constant bowel and urinary incontinence. Dr. Mulu Muleta's work is supported by Women and Health Alliance International in Gondar, Ethiopia.
This women who have suffered has to be treated and they have to regain their health so that they can live with that dignity.
This happened to me because of childbirth. I've been leaking for 18 years. My husband left me and I rented a house, but the owner kicked me out because of the smell. I never used to sleep because of the condition I was in. My heart was not at peace.
Dr. Catherine Hamlin leads the Addis Ababa Fistula Hospital.
These patients broke our hearts. They'd lost everything, their femininity, their money, their husband, their family. They were outcasts from their society.
The United Nations reports that in developing countries, more than 40% of women give birth without skilled birth attendants. There are not really enough health workers trained to perform emergency cesarean sections when a baby is too big or the birth canal too narrow. Comprehensive community-based rehabilitation hospital in Tanzania is working to cure women living with fistula and ensure that women have access to the care they need. According to UNFPA, the global campaign to end obstetric fistula reports at least 2 million women in the developing world suffer from obstetric fistula and need treatment. 50 to 100,000 new cases are reported each year.
Fistula is 100% preventable if you give proper obstetric care when it is necessary and somebody looks after proper antenatal care. You can prevent fistula.
Now, critically needed partnerships are forming, pulling together resources from charitable organizations, UN agencies like WHO and Johnson & Johnson Company. The result is increased training in emergency obstetrics and curative surgery for women who could otherwise never afford them. This support is vital.
It's very important that we are working with the University of Gondar here. We are working also with Fistula Foundation, with different organizations, and a lot of achievements have been made. Of course, we have to do more in the future.
Following fistula repair surgery, women are getting rehabilitative assistance. In one pilot program in Dar es Salaam, patients are being trained in professional skills such as tailoring and screen printing, and they receive counseling so they can better reintegrate into their communities. At last, a measure of hope for the future, for those most in need. Khalil Gueye, for VOA News, Addis Ababa.